Schizophrenia. Schizophrenia is characterized by delusions, hallucinations, and lack of insight. Acute schizophrenia may also present with disturbed behavior, disordered thinking, or with insidious social withdrawal and other so called negative symptoms and less obvious delusions and hallucinations, which we'll be discussing later in the clinical features part of it. So this was the definition. Next, pathogenesis. So how does it all start? Okay, first cause what we see is there is a strong genetic contribution, usually involving many susceptible genes. So each of a small effect. So what does this first point mean is there's not going to be a single mutation as such. Many susceptible genes will contribute in formation of schizophrenia. Then the next is environmental risk factors. There is a history of obstetric complications at the time of a patient's birth, and childhood adversity and urban upbringing. All this may pose as risk factors. Brain imaging techniques have identified subtle structural abnormalities in group of people. So when research was done in patients with schizophrenia, so they came up with the discovery, or they came up with that there was overall decrease in the size of the brain by about 3%, and mostly the temporal lobe volume was decreased, and episodes of acute schizophrenia may be precipitated by social stress and also by cannabis, which increases the dopamine turnover. Now schizophrenia is viewed as a neurodevelopmental disorder caused by abnormalities of brain development associated with genetic predisposition and an early environmental influence, but precipitated by later triggers. So all this which we discussed, all this in combined can be now viewed as the cause. Next we'll come to the clinical features. Clinical features of acute schizophrenia should be in any individual there is a bizarre behavior accompanied by delusions, hallucinations that are not due to organic brain disease or substance misuse. So this has to be noted down. In acute condition, there should not be any organic brain disease or substance misuse, but the patient will have bizarre behavior with delusions and hallucinations. The characteristic clinical features are listed down, so I'll see what is it. First, rank symptoms of acute schizophrenia. We can note it down as ABCD. First one is auditory hallucinations. Auditory hallucination is second or third person echo. Is broadcasting, insertion or withdrawal of thoughts. It means that there is insertion of thoughts or there may be withdrawal of thoughts, and there is controlled feelings, impulses or acts. Delusional perception, a particular experience in bizarrely a particular experience is bizarrely interpreted. Symptoms of chronic schizophrenia, whatever we saw now was acute, next is chronic. These are the negative symptoms: flattered affect, apathy and loss of drive, social isolation and poverty of speech, poor self-care. Next we'll see the clinical features now. Hallucinations are typically auditory but can occur in any sensory modality. They commonly involve voices from outside the head that talk to or about the person. So, usually, the person will feel like somebody is talking to him, but that that person is not present. He just hears voices. Then sometimes the voices repeat the person.